Guru Hiriyare Hagu Atmiyare, Ellarigu Adarada Namaskara. A warm welcome to one and all. 10th October is generally celebrated as World Mental Health Day. This year it is said to be something very special because of the way the numbers have panned out. 10-10-20-20, and it is supposed to be unique, which will never get repeated. Probably that is why all the activities related to World Mental Health Day at NIMHans is also something unique what is happening at NIMHans in that very context. Now, we also decided to have multiple events rather than just one event on the designated day. And this is one of those continuation events when we focus on the elderly and their healthcare. To bring us into focus, I would like to request Professor Pratima Murthy, Professor and Head of Psychiatry, to welcome all of us present here and also give us insights into what the program is about.
Thank you very much, Dr. Girish. I just hope that 10-10-20 doesn't ever repeat, okay. Because these are years that we would, this is a year that we would prefer to kind of quickly get over and perhaps forget. But on the other hand, I think it also raises several issues that actually become mainstream. We always say that there is no health without mental health, but that's kind of remained in some ways a jingoistic phrase. But I think it's in the context of COVID that we've all come to understand how important mental health is. And when we look at mental health of people, particularly in vulnerable circumstances, it becomes even more relevant to address this. So, as all of us are aware, the theme for this year's World Mental Health Day, as there is a theme every year, was about greater investment so that we can have greater access. And just so it's the whole month is kind of celebrated or commemorated as World Mental Health Day. And just for those people who may not be aware, I think 3 days ago we had a program where we had a very generous donation of, and since we're talking about investment, we had an investment, a promise of 10 crores from the Rural Electrification Corporation to set up a 40-bed dementia care facility at our Sakalwara campus in NIMHans. And Professor C.R. Chandrasekhar, who is seated next to me, has made a personal donation of 1 crore to actually support this event. So I think we've really begun with a bang in terms of talking about greater investment in mental health. So today's this commemoration of World Mental Health Day therefore becomes so much more meaningful because I think, we have really put our mouths where, our money where our mouths are. So in that sense, it's wonderful to have that. So for this program, I'm very, very happy to welcome several dignitaries who are there with us today. I'd particularly like to welcome our chief guest, Mr. R. Subramaniam, who is the Secretary, Department of Social Justice and Empowerment in the Government of India. And I think he is very, very keen on actually making sure that many of the facilities that are required for the rehabilitation of people with various kinds of needs are actually met. So, sir, we hope that this is a very fruitful engagement, which will lead to a lot of collaborative work in the area of mental health and disability. Also very pleased to welcome Dr. Virendra Mishra, who is the Director of the National Institute of Social Defense, who, is a guest of honor today. Again, I think it would be wonderful to closely work with you and your department in trying to take this agenda forward. I'd also like to welcome Dr. Sridhara Reddy, who's the Deputy Director of NISD. Closer home, our Director, Dr. Gururaj, has joined us virtually, and our Director in charge, Dr. Ravi, is also with us today. A very warm welcome to both of you. I mentioned Professor C.R. Chandrasekhar, and joining us online is Professor Mohan Isaac. Dr. C.R. Chandrasekhar, Dr. Mohan Isaac are what I would refer to as the doyens of community psychiatry, both in India and at NIMHans. So it's really wonderful that everybody's going to come together to commemorate today's event. I'd like to welcome the entire team. They're the hosts of this particular program. Dr. Matthew Varghese, Dr. P.T. Sivakumar, Dr. Preeti, my colleagues from psychiatric social work and from mental health education and from epidemiology, our registrar, and to all of you who joined us online, a very, very warm welcome to all of you. As you know, today Dr. Matthew Verghese will be telling us a little bit about the theme of this program. And then after we listen to our dignitaries, there is going to be a panel discussion, which is going to be moderated by Professor Mohan Isaac. And I'd like to welcome our panelists for this program, Ms. Rema Mohan, the CEO of National Stock Exchange Foundation, Dr. Srinivasa Nagesha, who joined us recently. He's the CEO of the REC Foundation, Professor C.R. Chandrasekhar, whom I've already introduced to you, Ms. Bharti Dewan, who's the cluster head of the Urban Poor Azim Premji Foundation and the Philanthrophic Initiatives, and of course, Dr. Ranga Reddy, who I've already introduced to you, and my colleague, Professor Sivakumar. So it promises to be a very exciting afternoon, so I won't come between you and the program that stands ahead. And again, once again, welcome to all of you. Thank you very much.
Thank you, madam. Thank you very much. The tragedy shouldn't get repeated, but we'll keep with the sweet memories of what has happened. And that's where is the theme, investing in mental health. I request Professor Matthew Verghese to share with us about the theme for this World Mental Health Day.
Good afternoon, everybody, and welcome to this day's program. Now, all of us know that the WHO theme for this year is mental health for all, greater investment, and greater access. So basically, what is planned is that we will give care to everyone and everywhere. Now, as per the recent National Mental Health Survey that NIMHans anchored for the Government of India, there are over 150 million persons in India who are mentally ill and require care. Now, this is about 10 to 13% of India's population. But the important thing to remember is that only about 40 million of this, only about a quarter, get access to healthcare services or any kind of care. So the remaining numbers, 75 to 85% of people who have a fairly severe mental disorder which requires care by some care facility, they go untapped. So this is what is called as a treatment gap. Now, looking at the global burden of diseases for India, we see from the Lancet reports that mental illness is 6th of the 20 leading causes of disability in India. So it's very important that we handle mental health. And 1 in 4 families in India have to take care of people with mental illness. So if you look at the huge burden that people with mental illness and families face, it's indeed a stupendous task for the government and for all of us to take care of all these people. Now, the risks for mental disorders in India are the extremes of age. So children, they are more susceptible, elderly are more susceptible. And the theme for this year's Elders Day was dealing with elders in the light of pandemic. So caring for elders is as it is challenging, and in light of pandemic, it's doubly challenging. The other targeted at-risk populations are women in the reproductive age group, everybody in the workforce, men and women, especially men who face problems of alcohol and substance abuse, and the urban poor. So if you look at people who are marginalized, people who migrate, people as it happened during the COVID pandemic, urban poor are highly susceptible to mental disorders. Now, I want to leave all of you with just 3 themes as far as this investment is concerned. And if you focus on these 3 themes, I would think that we can do a lot in terms of investment. Number 1 is public awareness and education. We must invest in public education and awareness. And you will see today the different posters that come out. These are just small drops in the ocean as far as this is concerned. But the government and all of us together must push for public education and awareness. And what it will do is that it will give you greater access because it will reduce stigma and make people aware and make people go for care. Number 2, in terms of care, is self-care. In the WHO pyramid of care, we all know that the maximum and the cheapest way of caring for mental health is self-care. So if you learn to take care of your stress, if you learn to do yoga, exercise, follow a good diet, and various other things that we can do all by ourselves, then we can promote healthy living and prevent disorders. Many of these disorders can be prevented. The important thing is that the things that prevent our non-communicable diseases are also the things that prevent things like depression, dementia, and a whole host of mental disorders. So these two things in terms of education and awareness and self-help and primary prevention are the hallmarks of healthy aging. And healthy aging is something that we're going to launch today in terms of a healthy aging campaign. Third thing is providing access, and that is making selective interventions in terms of early screening. So screening of at-risk population, detecting mental disorders early in clinics, in PHCs, and providing treatment for them. So in terms of screening for people early and providing intervention, that is a lot of things that we can do in terms of investing on the workforce, investing on health workers, investing on hospitals, investing on all kinds of clinics at every level. So these are, I think if we focus on these three things, we will achieve a lot of things. And that is something that we should focus on for the, as part of the Sustainable Development Goals, which the UN has set us for 2030, and that is promotion of mental health and well-being all over the country. I think we have laws, we have policies, we have programs. In the last few years, there's been many laws and policies and programs in India. And I think all these things will actually help us to push for mental health in India. So we must be careful of our minds, our future, and our humanity. Thank you very much.
Thank you very much, sir. I think you've placed it into the right context of sustainable development goals and to the larger vision of the humanity. Elders and friends, NIMHANS and National Institute of Social Defense have been collaborating proactively and in a very excellent manner since decades. So I take this opportunity and consider it a privilege to request Dr. Virendra Mishra to address us. Sir.
Thank you so much. And certainly we are glad to work with NIMHANS. And the topic which has been chosen for today's discussion is certainly very important, like investing on geriatric mental health. And it's interesting that currently India is known as having a demographic dividend. We say that the population of India, the average population of India in 2021 is going to be 29, and more than 65% of the population is less than 35 years of age. So we are celebrating the youthfulness of India, but actually, we are progressing towards, aging. As the data says, like in 2011, it was 8.6% of the population was senior citizen, but soon by 2050, it's going to be 19%. And by the end of the decade, in the century, it's going to be somewhere close to 34%. But that's a huge population, because we don't even know exactly what is the projection of age, what is the projection of the population of India by the end of this centenary. So we are seeing that the population worldwide, it's the same phenomena. The population is aging, and in India it's going to age fast. So we have to prepare and we have to invest right now, because if we invest now, we are going to reap the benefits of the investment later on. So we have to be prepared for that. So, but even internationally, WHO has decided to celebrate, to observe 2020 to 30 as decade of healthy aging. So when we say about decade of healthy aging, so certainly it is not healthy aging doesn't just mean physical health, but mental health also is a very important component. So we have to work on that. We have to invest right now on that. So mental health is, it's a very complex issue. Basically, it's not that simple as we see, a layman speaking about it. And it could be an interaction of biological, social, environmental, cultural, and economic factors, and can be triggered by various kinds of abuses as well, like physical abuse, psychological, emotional, financial, and even material abuse. So, and abandonment and neglect are very, very important component of mental health issues. And loneliness has been proven as one of the major factors of mental health issues at various studies now. So, there is a serious loss of dignity and self-respect, which the senior citizens are nowadays facing, and that is also leading to mental health issues. So now and this leads to the stigma and discrimination, as already which has been spoken by one of the speakers. So how do we we do that? How do we try to arrest the mental health issues? So that is one challenge we are facing, and that is the challenge which is going to increase many-fold in coming years, because as the number of the senior citizens is increasing. COVID pandemic has further exposed the vulnerability of senior citizens, and it more pushes the necessity of investment. So it has increased social isolation. You know that the loneliness has increased. So there is increase in risk of depression, anxiety, disorder. And interestingly, there are many number of cases of suicides which are coming, which has been reported of senior citizens. And many of the cases, I've been told that it is because of this, their fear of this COVID. Either they are going to get themselves affected, or otherwise they think that if they get affected, their kids can get affected, or their children can get affected, or grandchildren can get affected. So there are a number of cases which have been reported. Just to quote few, in Punjab, elderly couple took this. They took poison just because they thought that they can be affected by this COVID virus. And similarly, in Punjab, one of the senior citizen committed suicide, saying that if they survive, so they can affect their daughter. There have been cases in Maharashtra, in Tamil Nadu, where in government hospital, where in an isolation ward, a senior citizen committed suicide. So the vulnerability increases of the senior citizens. There is a study of International Psychogeriatric Association, and which was done between 25th March to 16th May. It was a 52 days, they observed it, and they found that in that study that there has been increase in 40% in the mental health issues in India. And that's a huge number, 40% increase. If that study says, if that they are projecting it, I don't know how authentic it is, but that's a huge number. And the suggestion that they have suggested, the solution is that there should be more family intervention with social cohesion. And when we say social cohesion, the role of the community, the RWA, the friends, the intergenerational bonding that we talked about are the factors which has to be considered. So for caring of the elderly, security is the most important thing which I feel, and social connectedness is one thing which we should focus on when we are to somehow minimize the mental health issues. If possible, because the senior citizens are not moving out, so if tele facilities can be provided, and at the same time, besides tele facilities, if we can empower them, if we can build their capacity so that they can go digital, because the senior citizens, when they were at the prime of their youth, they were not very much exposed to the digital things. So now all of a sudden, if they are asked to go digital, it's a challenge. But so that is also one thing we should work on. So there are few things which can help us to somehow contain these mental health issues. And NISD is also trying to somehow contribute in this in this area. So we are broad basing the caregivers. We are starting the online courses even for dementia care, and for caregivers also we are trying to do it. And as one of the important goals which were set earlier by the speaker, public awareness should be increased. So NISD has the mandate of spreading awareness, and we are already committed to that. And through our partners, even NIMHans is one of them. So we try to do that. So thank you so much for having me here and for bringing this important issue. Thank you.
Thank you very much, sir, for bringing out the vulnerable and also the vulnerabilities. and also focusing on need for community involvement and defining its scope. Thank you very much. We look forward to the continued association and collaboration. One of the things what is often quoted, which is also the motto of National Educational Institution, says, Nahi Gnanena Sadrusham. This is the era of knowledge revolution. I think rightly so, when we are talking about investment in health, and Professor Matthew was talking about awareness, we have brought out a series of resource materials. I take this opportunity to list out all the resource materials brought out by the team. We would have a virtual launch of each one of them, and then I would request the dignitaries here to formally release and then stand for a photograph. The first one is the Kannada translation of the World Health Organization's manual on help for care partners of people with dementia. Yeah, this is indeed the need of the day. The second book is, can you go to the second one? Okay. The second is a resource book on elderly mental health for community health workers. In fact, this is an updated version of the PhD thesis of Dr. Anila Jacob from Psychiatric Social Work, which has been updated with more chapters, and that is where it is being released today. There are then 4 posters. Yes, 4 posters on World Mental Health Day theme. Thanks to Health Education Department of Psychiatric Social Work, Psychiatry, along with the interns of the Mental Health Education Department, who have done these 4 posters and also the brochures on health and wellness centers, mental well-being, mental health services provided under the DMHP, Workplace Stress Management, Mental Health Care Act. There is a whole series of them: mental health for LGBTQ communities, taking care of mental health of prisoners, and also the mental health of people living with HIV, TB, leprosy, and COVID-19. Please give a big hand to all these resource materials which are generated and which are being e-launched today. I would request all the dignitaries here to hold the posters so that we have a group photo.
So each one should hold different ones.
Yes. No, I think I just may have missed in terms of recognizing another big resource what we have, who have done the walking, not just the talking. We have 2 institutions, or rather, as we recognized earlier, 3 organizations which came forward to make this World Mental Health Day special for us at NIMHans. In fact, day before yesterday, the REC Rural Electrification Corporation, the REC Foundation, and Professor CRC. I would also consider Professor CRC to be an organization in himself. He is known as the Bhishma Pitamaha for all community mental health personnel. But more importantly, also, he's been that organization who reaches out to the general public with respect to mental health awareness, which Professor Matthew was. His works run up to more than 300, and the number of pages, written pages, run up to more than 15,000 printed pages. Indeed, that's a laudable achievement. Thank you very much, sir, for giving us all this support and encouragement and promising to be with us. I would like to request our director, Professor V. Ravi. I request permission of Professor Gururaj, our director, to felicitate Professor C.R. Chandrasekhar.
Please go ahead, Ravi. Absolutely no problem. I mean, it's an honor to recognize Professor C.R. Chandrasekhar, who is amidst us today.
Thank you very much, sir, for consenting to honor you. I'd also like to take this opportunity to felicitate the REC Foundation for making this huge commitment and also the investment at NIMHans for this 40-bedded pediatric ward. And we have the E. Because of a change in program, the technology revolution has also changed a whole lot of things. The new norm, multiple events seem to cross with each other. Yes. Thank you very much. As we said, it is not corporate social responsibility, but also it's social accountability for each one of us who are here, who have made this thing possible. So in this context, I'm quite privileged and happy to request Mr. R. Subramaniam, Secretary, Department of Social Justice and Empowerment, Government of India. Sir, request you to address us.
Thank you, Professor Gururaj, Professor Ravi, Professor Pratima, and I think Mr. Professor Shankar Narayan Rao and all the other experts sitting here. It's an honor and a privilege to be in NIMHans, which is one of the most premier institutions of this country, and which has done phenomenal amount of research and made India proud. And you have actually set not only national standards, but this institution is regarded very highly in the global knowledge scenario, and we are very proud of this institution. And some amount of coordination we have had in the past with NIMHans, but I think, as I can see, this is a field which requires to be further explored. So friends, I mean, you are all the experts, but I know one thing, that mental health issue is one of the most common disease, most common ailment, which virtually everybody faces at some point or the other in his life. And it's just that I think some people come out and then express, and many people just suppress. But the suffering is there, and this suffering is, I would say, ubiquitous, because I would refuse to believe that if anybody says that he has never faced any stress or some sort of a mental health issue during his lifetime, he is just lying. So friends, so this is such an important issue, and today, of course, this is you have actually contributed a lot in understanding this in many ways. We have handled this issue in my previous role as Secretary Higher Education. We used to face this day in and day out in premier institutions, where the best of students coming from best of backgrounds, academic backgrounds, they cannot cope the stress and then have resorted to many life-threatening situations, and we have all seen, and that has been one of the main concerns of the government at that time. As I come here as a Secretary of Social Justice, looking at the elderly care, I find that the situation, of course, is extremely alarming, because we have 14 crore senior citizens today in this country. and many of them, with very few exceptions, face serious mental health issues. Primarily because the stress here arises out of the feeling of not being wanted or not being useful to the society, not able to contribute something, not having any meaningful activity in life, primarily that. And of course, there are biological factors which lead to deterioration, you know that best. So our entire focus on the elderly care is on how to make the living more dignified and healthy aging. I mean, you have all said, and today, these days, this is one major slogan that's how do you have a healthy aging process. So, friends, I just wanted to state that that there are a few things which I want that we are trying to look at this when we are reformulating our national policy on elderly care. As you know, our last policy was in 1999, and now today we are in a position to come out with a new policy because so many things have changed. New technology has come, new treatment techniques have come, new awareness is built up. A lot of research has been done in this. So we wanted to update this policy. So I would like to state 3-4 things and then leave this to the experts like you are. First thing is that elder care cannot be one agency's effort. It cannot be government effort. It cannot be doctor's effort. It cannot be family effort. It cannot be the kith and kin's effort. It has to be a collective national effort, because there is a role for everybody, every agency, whether it's a government or NGOs, corporates who have, like REC, who has come forward today. There is a role for the community as a whole. So I think we must recognize this and see how we can bring in synergies of various agencies which are involved in the elder care, so as to deliver a product which is required by the elderly population. So it has to be a national effort, and we must find solutions for this synergy. Second thing is that we need to have a listening mode, because in many places what happens is that we see that the elderly care suffers because nobody wants to listen to them. I mean, they are just trying to say that, he keeps saying always like this, but nobody is trying to understand as to what is the problem, and then try and see whether he can bring in some solution to it. So we need to have a listening post for every elderly person, and I wanted to tell you that we are going to launch what we call as an elder line. That is, it's a helpline for the elders, possibly from 26th of January, where we are going to bring in large number of people who are trained, who would listen to the senior citizens. If they just give a call, they will listen and then understand the problem and then suggest a solution or send some help in order to meet him where he is. So this is going to be major effort, because we are trying to do it in almost 20 states, 20 states where, along with the state governments, the NGOs, the institutions which are running elderly care things, district administration, sub-divisional administration. So we're going to bring large number of actors together in launching this elder care, which is nothing but a listening post. You have to hear and then find solution. Friends, third thing I wanted to state that we are actually investing very little on the elderly care. I think the government's investment today, if you look at it, it's laughable, because I can say it with confidence because I can be self-critical. We are talking in terms of 14 crore people, but what we spend is some 200 crores, not even 200 crores. So what we are doing is a marginal amount of what is the task ahead. But I wanted to tell you that the government has formed what is called as the Senior Citizen Welfare Fund. And this fund, the government has promised 9,000 crores. And then as and when there are they have identified a source through which they are going to bring funds into this. And it is going to be extra budgetary sort of a facility. So we are having an opportunity today to expand the scope and then scope of our activity, and then variety of our activity and intensity of our activity, so as to reach out to large number of people and where they require help. So for that, I just wanted to mention that funds would not be an issue. We require brains to come together to think in terms of solutions. So in order to do this, that's my fourth point, is that we have now constituted 7 working groups. One of it is looking at mental health, health issues in general and mental health also. So these working groups are, we have requested them, they are consisting of experts. We have requested them to come out with an action plan which can be implemented straight away. I mean, there is a lot of debate about whether you should have a good policy or good action plan. So we believe that we should have both. But then most importantly, we want to have this action going. So this working plan, the working groups are already working, and we are expecting that they will submit their reports next month. And we are really hoping that on mental health, we'll have some very concrete recommendations by this working group, and we would be dipping onto all your experience, all your knowledge, and all your advice in order to concretize this sort of an action plan at the national level. So we want to get cracking from 2021, from the break of 2021, so that we want to give a good, a dignified life to each one of these 14 crore elderly persons. And we are also working on providing some sort of a livelihood opportunities, because we find that many of them are in fact having so much of energy, experience, that they can be very useful for the society at large. It's just that we refuse to recognize that a retired person can be useful. I mean, that's something. Retired means like you are gone. So it's like, batsman getting out and then sitting in the pavilion. But then from the pavilion, he can direct the game. He can advise, he can give lots of tips. So we are really looking at providing that sort of an opportunity to each of the retired persons on the livelihood platform. So a lot of action we are expecting from 2021, and this is the time for us to work together. I'm very happy that I'm with such respected lot of scientists and doctors, and we would like to take this association further, and then for the benefit of everybody. Thank you very much for calling me here. Thank you.
Thank you very much, sir. You've spoken very sweet words, because several of the things, ubiquitousness of stress, healthy aging process, reformulating the new policy, bringing synergies, listening more. These are something which is very, very near and dear to us. With your permission, I think we have also put together a program for the elderly related to mental health, known as the Vayomanasa Sanjeevani. We have a dedicated portal for it now. I take your permission that we have an e-launch of that portal. This program essentially deals with several of the issues which you have brought it forward, and we'll continue to dialogue with the entire department so that this becomes useful to the larger community. Thank you very much, sir. Also take this opportunity to felicitate Icon Life Sciences for contributing majority towards setting up the Vayomanasa Sanjeevani portal, helping us conduct webinars, certificates, and designing flyers. Thank you very much, Icons. Elders and friends, I take this opportunity now to request Professor G. Gururaj, our director, to address us.
Thank you very much, Girish. Am I audible?
Yes, sir.
Yeah. Thank you and good afternoon. Namaste to everybody. It's a great pleasure to see several faces, several organizations, the ministries, everyone coming together to join on this occasion of celebrations around the World Mental Health Day. In fact, today morning, there is a just released paper from Lancet, which proudly says that India added about 10 years to its longevity between the period 1990 to 2020. You just added 10 more years. So the earlier life expectancy, which was around 60, has now gone up to about 72.6 years. And that is a very great positive development, which shows the successive reforms, policies, and programs of the government, both at the center and the state, in terms of contributing for the health of people, which has added a lot of new years. This has been possible with the remarkable success, or I wouldn't say remarkable, but with the moderate success that we have achieved in the area of communicable infectious nutritional disorders. But at the same time, the health scenario is changing very rapidly and very fast. We see that the observations that are made indicate that while the life expectancy has changed, a question has been asked, is it a healthy change in the life expectancy? It's a bit complex term. It only asks the question, are the people who are living longer today, are they living totally healthy? There have been several research activities done in India and outside, which show that beyond the age of 60, several people, most of the people, suffer from a variety of physical, mental, social, emotional, economic, and several other related problems. And all these are not just standalone problems, they're all intricated problems. And the overall effect of this is that basically life becomes very complex, the quality of life comes down, and at the same time, the support systems are very much required. This is an important observation that has been made at the beginning of the decade of aging, which brings us back to the central question, how do we make life of the elderly people more useful, more pleasant, and at the same time, they are able to adjust to the complexities of life in that age and also lead a very productive life. With this question in front of us, we also have several developments that are taking place amidst us. Mental health has definitely come to the forefront in this long series of changes and developments amidst us. And mental health has, as we all know, affects everyone in the society from pediatrics to geriatrics. NIMHANS over a period of time has taken a strong life course perspective. We have been trying to address mental health issues, whether they are children, whether they are adolescents, whether they are working populations, or whether they are elderly, and also in both urban as well as in rural areas. So in that direction, a couple of years back, some of you would recall when we were starting the Center for Public Health at NIMHANS, we were trying to find what should be the tagline or the theme for the Center for Public Health for its activities in the coming years within NIMHANS. So one of the things that we came up finally and we continue with is finding solutions together. I don't think there could be any better challenge or better approach to manage health problems of people than finding solutions together. The problems are very complex, solutions are little, and efforts need to be really strong. NIMHANS in that way has been working and has taken the leadership to develop and contribute for several activities at the local level, at the national level, and even at the international level. Like Professor Matthew mentioned, the National Mental Health Survey, one of the strong attempts to find out the problems of mental health in the populations revealed that even among the elderly in the 60 plus age groups, nearly 15% of them have lifetime mental health problems and about 10% have current mental health problems. And this is really, has got compounded in the COVID times more because of the uncertainties, with the complexities of dealing with the situations, of the social isolation that it has brought about, and also difficulties in accessing care. We have been reading quite a lot in terms of the challenges that are faced, and even today's newspaper, if you see, it tells very clearly there is a sudden rush for dialysis among people with non-communicable diseases into dialysis centers. It's not just only one problem that confronts the elderly, but several health problems confront them. And it's a mix of that. And it's very challenging at this time to find these solutions for that. But at the same time, like as Mr. Subramaniam just now mentioned, there is a national elderly health policy that is in the offing. There are action plans that are being set up. There are the elderly individual programs that are operating in different parts of India. And at the same time, several helplines and others are there. But one thing that is clearly that has emerged is the fact that the existing services and programs are fragmented, patchy, and at the same time work in silos. And these issues cannot be, the complex problem of elderly mental health cannot be addressed in isolation or in silos, but requires people to come together and to work towards finding solutions as well as to implement these solutions. We have several policies and programs. In fact, the National Healthcare Program for the Elderly was started several years back, but which has only made very little progress in the last decade. And it has not moved beyond the curative sphere and into the several related aspects. If we agree to the fact that nearly 70% of our people in rural areas need mental health services, and elderly in these places need much more of mental health services, we know where to put our resources in. So, a few days back, somebody asked me, why is the theme of this year's World Mental Health on a very vague theme like greater investment, greater access for everyone, everywhere? Why is it not focused? Why is it not specific? And this was brought about very clearly, primarily because of the neglect in the field of elderly health over the last several years. In fact, the discussions for the themes for the World Mental Health Day begins almost 3 or 4 years back, and recognizing what would be the problems, the themes are identified. And I was part of some of the discussions that were centered around this, and it was very apt to call it as greater investment for greater access to everyone, to everywhere, primarily because elderly today are in such great lack of services of all types. It could be curative services, rehabilitative services, preventive services, promotive services, integrated healthcare services. And with that reason, this came into the forefront. And I think the decade of healthy aging has just begun. NIMHANS has taken the first step in moving this agenda forward. And I think that's a significant first step. And I would like to compliment all our colleagues at NIMHANS for taking this first step in bringing some of these activities together. NIMHANS has been working in the area of geriatric mental health for a long time, but has been accelerating its work over a period of time, moving from the four walls of the hospital into the community, led by the earlier work of our leaders like Professor Chandrasekhar, Professor Mohan Isaac, Professor Srinivasa Murthy, and several others as early as 1980s. NIMHANS has been taking steps in different directions, and elderly mental health care is one such program. We have seen a amalgamation of minds coming together, Professor C.R. Chandrasekhar has been kind enough and gracious enough to provide financial support for the maintenance of the rural Sakalvara center that is coming up. The Rural Electrification Company has extended support towards the construction of a 40-bed residential care facility. The Icon Foundation has come up with a few other things. And the Ministry of Social Justice and Empowerment has extended its support. The National Institute has extended its support. So we are already seeing people, organizations, agencies coming together to work in this direction. And that is the first step that can happen. And I'm sure as we go along, we will definitely work with several other agencies at local, national, and international levels to see that the decade that is in front of us will be a really productive one and will also be a very successful one. And at the end, we'll be able to deliver a large number of curative, promotive, preventive, as well as rehabilitative services to the senior citizens in our country. At the same time, I would like to mention that when we talk of the question of investment, where to invest and how to invest, it's important for all of us to recognize that we need investment just beyond financial terms. Finance is definitely required, and that's what which sets and rolls out number of activities. But at the same time, we need investment in sound and scientifically valid as well as evidence-based policies and programs. And as Mr. Subramaniam mentioned just now, in solid concrete action plans that are time-bound, that are responsive, and also that can be measured in the way we make our progress. We also need programs that are culture specific, that are not just borrowed from the West, but which meets the requirement of our own people in the environment we live, and at the same time, which suits the financial availability of our own people. And I think a blend of all this needs to happen to see that what we deliver or what we promise to deliver really reach people in the remote corners of this country. We also need to essentially remember one other thing apart from the curative services, which are always focused upon, like the dementia care, which is most important because the individuals and families find it extremely difficult to manage these individuals. We also need to make a sound investment in mental health promotion. And that's really the need of the day in the complex societies where we live in. The stress and strain, the fear that surrounds us, the insecurities that engulf us, all these make life very difficult and very complex. Investing in sound mental health promotion is equally important to protect the mental health of people who are around us. NIMHANS efforts has been really significant, and I understand from my colleagues, Dr. Sivakumar and others, that already much of the activities have begun. We also placed a request to develop the national initiative for training in geriatric mental health with the Ministry of Social Justice and Empowerment. And I request Mr. Subramaniam to seriously consider this, because this becomes the launching pad. This becomes a ground on which we start our new activities, because this initiative for training in geriatric mental health is very much required now. There are a number of training programs that are ongoing, ranging from 10 days to year-long programs. But what would be required is to tailor make these programs in a way that can blend a large number of things together, which can provide comprehensive elderly mental health care. I request the ministry to seriously consider our request and to extend and support this initiative. Probably in the action plans that you mentioned, sir, it will be useful if this can be tried out on a regular scale at NIMHANS, and probably the lessons learned from this can be scaled up to other states as well as to other parts of India. Similarly, we have also been seriously considering a national skill training for caregivers of people with elderly mental health problems. And that is again another requirement. The families members, while providing continuous and constant care for the elderly, especially with conditions like dementia, Alzheimer's, and serious mental health problems, have very major, serious, not only burnout issues, but they themselves are at a higher risk of developing mental health problems. And I think that is an area which has not been addressed, but which has just been taken for granted. There are people around these people who can take care of them, but it's not as easy as it is said. Caregivers face enormous problems, and especially in the urban environments where they have to balance life and work, where they have to balance family and other demands, and it's a very difficult situation. So finding out the right solutions for them is equally important, and it's also one of our major responsibilities. We have requested the National Stock Exchange Foundation to consider this request, and I'm sure our partners will seriously consider this and help us in developing this. So NIMHANS has been launching several of these programs, not just in the area of only treating people, but moving beyond treatment to other areas of policy, program, advocacy, awareness, training, skill development, residential care facilities, community mental health care, to all these areas. And ultimately, all these are the ones may appear individual and isolated, but efforts from all these will join together to develop a comprehensive elderly mental health program. I'm sure by the end of the decade of 21 to 30, we will have significant results to show that we have contributed as an institution, as faculty members, as partners in this program, that we have been able to reach out to elderly people and to help them. I just concluded a decade of work that we did in the area of road safety, because 2011 to 2020 was the decade of road safety. And if I just look back and see what this decade achieved, I think it made phenomenal progress. It had several setbacks and challenges. It had several difficulties, but as a global community and at the national level, the national governments and many, many organizations came forward to make our roads safer for road users. Similarly, I feel that the decade of 21 to 30 will make life easier for our senior citizens and make their life more meaningful and productive. And we at the institute and outside the institute and with all our partners, let's join to find solutions together and to make this journey a successful one. Thank you very much, and thanks for this opportunity.
Thank you very much, sir. Thank you very much, Premji, from the Geriatric Mental Health team to help us take this first step, and not just the first step, but also showing us the way forward in terms of how to go to the next 10 steps forward. I'm sure that inspiration and motivation will stay with us to look forward to the next decade when we celebrate the decade of elderly. Professor Matthew Varghese just gave me the snippet of information. I believe Bangalore stands 24th amongst the 30 global cities worldwide in terms of readiness for Dementia Innovative Readiness Index 2020. Sir, would you like to share? Okay. So 24 out of 30 is still a long way to go. I think we need to find what to plan for in future. I also take this opportunity to thank Ms. Veena Hedji for doing the Kannada translation of the resource book. Thank you, Veena, for all that support and being with us. With this, I would also request Professor V. Ravi, our in-person director, to give his thoughts and comments.
Namaskar and good afternoon. I just would like to say one point, that the SARS-CoV-2 virus has taught us a lot. Being a virologist, I thought I should definitely mention that. And the biggest learning for general public has been to use digital technology. I do not wish we have another outbreak like this, but I must tell you that it is likely, if you look at the history of this century, from 2000 onwards, this is the 5th global outbreak that has occurred. So I think the learning is very clear, the writing on the wall is very clear. If we have to increase access one of the best investments is to improve digital literacy and make it very friendly to the elderly. I think that's one thing that we all have to work together. Being in Bangalore, a city with so much IT power, I would request my colleagues at NIMHans to start thinking about it on how we can make access through the digital platform for delivery of services. Very happy to be associated with this World Mental Health Day celebrations, and I wish everyone that they realize their dreams in terms of improving access and thinking of new investments. Thank you very much.
Very much, sir. I'm sure that your words are a warning for us and also a pointer as to what we should be looking at. Thank you very much. I now request Professor Shankar Narayan, our registrar, to give the vote of thanks.
So good afternoon, and I thank each one of you be the part of witnessing the celebration of World Mental Health Day at NIMHans. And it is more apt that this year you have a decade for the elderly. In this connection, we have a team of the organizations came forward to support, enrich, and also to provide a comprehensive integrative health care for the elderly. On behalf of NIMHans, I take this opportunity to thank who is the guest of honor today, Dr. Virendra Mishra, who is the Director of National Institute of Social Defense, and the chief guest of today's program, Dr. R. Subramaniam, Secretary, Department of Social Justice and Empowerment, Government of India. Both of them, they gave a wonderful inputs, and also the vision is very, very clear. During this decade, how we have to take care of the elderly population, what should be the plans, and how we should work together to help comprehensive programs should be awarded. And also, more importantly, human resource development also is important. Train the right people who could help the elderly. In that juncture, I would like to thank and also place on record the CSR activity of REC and also our CR Chandrasekhar, very senior colleague of NIMHans, who served more than 45 years at NIMHans, and subsequently he runs an organization called as Samadhana. Wonderful psychiatrist with a great passion to care the elderly, and he has come forward to donate 1 crore for various the elderly care services which will be offered in our South Campus of NIMHans. Thank you very much, sir. Thank you. And also, you have the icon has contributed in terms of various of the activities of our team at NIMHans, the geriatric healthcare team, mental health care team. I also take this opportunity to thank Professor Pratima Murthy, Professor Matthew Varghese, and the entire team of panelists who is going to discuss about various components of the elderly population in terms of the various strategies, how we are going to take care of them, what is the need of the hour, how does the demands can take this program as a flagship program in collaboration with NISD and also in collaboration with Government of India. I'm very sure that the help what is thought by our director Professor Gurraj, to the Secretary, Shri Subramaniam, the inputs what you are going to provide and also the avenues which you are going to open up for the elderly care, sir. It will be taken very seriously from the NIMHANS end and it will be implemented as per the directions what we are going to have it from Government of India and also the other various organizations. I take this opportunity to thank the panelists, Rema Mohan, Srinivasa, Professor C.R. Chandrasekhar, Bharti, Dewan, and also Dr. Sridhara Ranga Reddy. And the team is headed by P.D. Sivakumar and the colleagues at NIMHANS. I'm very sure that the discussions and the deliberations during this panel discussion is going to give a framework for not only to the NIMHANS, but to the entire country, how we have to take care of the elderly population in all components with a very comprehensive, integrative support system which we have to evolve. I'm very sure with the amalgamation and the support of NIMHANS, corporate, Government of India, NISD, we'll be very sure that this decade is going to be fruitful for elderly. I take this opportunity for all the resource people of our NIMHANS team. They have brought out a wonderful posters, the very resource materials, and each one of that will be available. And I am sure there are many more such resource materials and the training programs is in the pipeline. On behalf of the entire NIMHANS family, I take this opportunity to thank our director, Professor Gurraj, and also the in-person director, Professor V. Ravi, and the entire team of psychiatry, social work, health education, and also the media who is covering these events. On behalf of each one of you, I take this opportunity to thank each one of you. Thank you very much, sir.
Thank you very much. As Professor Gurraj in one of the earlier meetings had said, indeed, all these things are historic as NIMHANS, and I think we'll continue to be a witness to this new history which is in development. Thank you. We'll just take a 30-second break and then reconvene again for the panel discussion. I know the time what we had slotted earlier is not available to us anymore. It is 3:38. So I think we should be able to do about 30 minutes for the panel, 30 minutes plus or minus. Let's take this 30 seconds break and then we'll start the panel discussion. Thank you. Thank you once again, all of you.
Thank you.
I would like to request Professor Mohan Isaac. Sir, could you come online? Okay, thank you, sir. I would like to request Ms. Rema Mohan, CEO of the National Stock Exchange Foundation. Madam, would you be able to? Yes, thank you. Warm welcome. I'd like to request Ms. Bharti Dewan, Cluster Lead, Urban Poor Azim Premji Philanthropic Initiatives. Welcome, madam. Yes, Dr. Sridhara Ranga Reddy is here. I always miss him because he worked with us in the department for a long time and favorably call him by his first name, and now suddenly I slip back into that original. Thank you, Dr. Reddy, for joining us. Then we have Dr. P.T. Sivakumar with us.
Thank you, sir.
Professor CRC would be joining us. I take the liberty and permission from Mohan Isaac, sir. Sir, I thought looking at the time, we could give each one of our panelists about 3 to 4 minutes to make their initial comments. And possibly I have got a list of questions which have been given to each one of the panelists, but I'm not sure whether we'll be able to go through each one of them. But I thought given the context, if each one of you could make those initial comments, about 3 to 5 minutes. And then I would like to request Professor Mohan Isaac, sir, kindly be the chair for the session and then guide us forward. Would this be okay, sir?
It's perfectly all right. But I think, since we have limited time, you should moderate, giving the timing to the people, and I will make some concluding comments at the end. So we should straight away start with the first speaker. And
Yes.
May I request you to do the inviting and introduction, etc. And
Okay,
then I'll
sir.
make some concluding comments. Thank you.
Okay, sir. Thank you very much, sir. First, when CFC sir will settle down, I'll just take request Ms. Rema Mohan, CEO, National Stock Exchange. But I find this entire panel is quite an ensemble because we have got people from different walks of life coming in. And it was a very pleasant surprise to look at several people who are concerned about elderly. And then we thought this would be a right opportunity to discuss and deliberate, particularly in the context of what is in the offing. Particularly the National Institute of Social Defense is on the verge of looking at a paradigm shift in their activity. NIMHans is taking up, as sir said, baby steps, and then we are looking at what could be charted for the decade of aging. We find it intriguing and interesting to find National Stock Exchange Foundation coming into this picture. Madam, would you like to share something about your organization and more particularly with respect to elderly healthcare? Madam, kindly unmute yourself.
Yes, sir. So it's been a very enlightening experience today afternoon, an afternoon well spent. Thank you so much. Wonderful dignitaries, such erudite discussion. Thank you so much. The National Stock Exchange, as we all know, is a premier stock exchange of India, which has been set up by various financial institutions at the time when our nation most needed it, to improve and increase the retail equity market participation and strengthening of the retail and the equity markets by high standards of governance, transparency, and honesty that goes with it. The NSE Foundation is the implementing arm of the CSR activities of the NSE Group. We have about 6 contributing companies to this. Our spectrum of activities is quite large. Our core focus areas are education and elder care. So 2 spectrums, the small children and the elders, water, sanitation, hygiene, environment, and skill. And each one of these is interlinked with each other. And recently in 2018, we also adopted 3 aspirational districts for a holistic transformation in Rajasthan, Maharashtra, and Tamil Nadu. Coming to elder care, we first started in the urban areas. Then we thought we must shift our focus to the rural areas. The needs of the urban elderly and the needs of the rural elderly are quite different. To give a scale of our operations, I think as on date, we have around 1,400 elderly self-help group. That's more than 15 to 20,000 direct beneficiaries. I like to call what we engage in as a AAA activity, where we are looking at access, activity, and enabling of the elderly in the various activities that, so it is in the health that is the empowerment. So it is an empowerment model. How do we empower the elderly financially? Through the health activities and through social activities. So this, in a very broad manner, is a three-pronged approach to the elderly. So as I said, more than 20,000 elderly directly benefiting from our activities. And of course, we have a larger spectrum as a cascading effect, the families and various other things like legal rights and also in the sense of financial rights and legal literacy. So all these other type of literacies that go with empowerment. So this, in a very short and as far as I could encapsulate it, a very brief nutshell. But related to this program, there are 2 points that I would like to bring out. Recently, across all our self-help groups, we have tried to strengthen our financial literacy, as well as the ease of using electronic products. It could be how do you operate a bank account? How are they? How do they become literate? Not only literate as in the sense of learning to read and write, and also the other type of literacy that is there. The second is when we're talking about mental health specific to this session today, we have found across most of our programs around 30 to 35% of the groups that we have, people that we have some type of mental disorder, which comes from various other reasons and rationales. I won't get into that. Since you have already indicated that there's a paucity of time, I will stop here and over to you, sir, and to the other panelists. Thank you so much.
Thank you, madam. I think one word which stands out is a missed opportunity. We had missed the opportunity to interact with you earlier, and now you have found a lot of missed opportunity where NIMHans could have been part of it. We look forward to the continued collaboration. I'll come back after we finish the first round of. Sir, I would now like to request Professor CRC to share his thoughts on elderly care.
So just now we heard that the longevity in India has risen to 72 years. That more and more people are becoming elderly citizens. One way it is good, but in another way, we are facing a lot of problems. Now we are again celebrating the decade 2021 to 2030 as the decade of healthy aging. I think personally, I feel that every one of us have to invest from the age of at least 40. I think we should educate every person in our country that he or she has to invest himself or herself. After 20 years, he or she should continue as a healthy individual, healthy and happy individual. It's not just asking government to give money or some NGOs to come and serve me or my children to come and help me. I think this type of attitude has to be changed. That we have to tell the entire society, entire community that they have to invest to their old age. How to remain happy, how to remain healthy. In this regard, many elderly people, they think that they are under the mercy of their children. They are under the mercy of God. Go to any temple, go to any worship places, middle-aged and elderly people are there, praying God to remove their difficulties, to give them good health, to give them security. And so if they are not secure, if they are ill, then they think that it's a fate. So many elderly people develop an attitude, a defeating attitude that they have to suffer. They have to suffer. Either because of their past bad deeds or their own contributions or society's bad management of senior citizens. I think we should fight against this defeating attitude of elderly people. It just has roots in the culture, the karma theory. Karma theory says that if you do good karma, you remain happy and healthy. If you do bad karma, either in this life or past life, you suffer. That's one thing. That is how to look at aging with positive attitude. I think we should because all our visual medias, they are just spreading the old concepts which carry negative connotation to the society. Whether it's God's curse, whether it's black magic, whether it is bad alignment of planets, and a whole lot. And elderly people are told, even if services are available, they don't go there. They don't understand the depression. They don't understand their other anxiety disorders or ailments. And then they simply go for magico-religious interventions, where they waste their money, waste their time, waste their resources, and unnecessary. So we have to invest a lot in public education. In the last 45 years, like Mohan knows, and all my colleagues know that from day one, I became, even as a medical student, I thought we had to do a lot of health education activities in our society to make people to become self-sufficient, to keep themselves healthy and fight against diseases which come on their own, and then how to combat with various difficulties of life. So in this regard, I think our geriatric team has to take up in this big way, and also Government of India and Government of Karnataka should have a control over the media. Because we have that, nobody has any control over the media. They can play anything they want to increase the TRP and increase the unscientific attitudes and blind beliefs among all sections of people. So the investments and accessibility has to be done in the right way, and a lot of education has to be done. And all elderly people are not disabled. We know that all. I meet a lot of senior citizen associations in Bangalore and the various places. 50% of them may be disabled to a certain extent. Other 50%, though they are 60, 65, 70, they are still active and fit enough to carry on many activities. So we have to involve these fit and energetic senior citizens, 12 others who are having disabilities and problems. And also how to safeguard their financial safety. Just now we have that some NGOs come forward to give some money, or government gives 1,000 rupees as an elderly pension. Then I think each person has to take up this task of having financial security for himself or herself, not giving away everything to the children and look at them for support when they become old. So in this regard, I think all of us should put our heads together. One is prevention, promoting healthy aging, preventing diseases, disabilities, and once, of course, people are disabled, dementia and other physical disabilities, how to take care of them and where they should go, and instead of cursing themselves, cursing their fate, or going to some other faith-healing agencies.
Thank you, sir. I think a key word which comes out when sir was talking is, I think we need to decode in this decade of healthy aging. And then also sir said decode or recode ourselves with respect to our earlier thing whenever we are talking about digital initiatives. Now, I think this brings us rightly to the point I think I can request Mrs. Bharti Dewan to talk about the urban poor initiatives of Azim Premji Foundation. I think, madam, I'm sure you would have faced similar such situations at the field level, particularly when interacting. I request you to share your thoughts on it.
Absolutely. So good afternoon, everyone. Extremely wonderful sessions and wonderful webinar. And I'm extremely pleased to be part of this. I work with Azim Premji Philanthropy. It's part of group of organizations founded by Mr. Premji in the social space. We are not direct implementers. We provide grants to the organizations who are working on the ground. And the issues for which we fund the organization ranges from gender, children, farmers, issues of urban poor, governance, and many more. I am part of Urban Poor Cluster, and our focus areas in urban poor are issues of homelessness, elderly, migrant informal sector workers, slums, manual scavengers, and rag pickers. And at Philanthropic Initiatives, our mission is to facilitate a just and humane society. We are committed to our partners, our grants, and the actions to bring real change on the ground. So technically, we are not the change makers. It's our partners and the communities. We support good people doing great work, and always guided by the problems, and try to do what it takes to bring change in the lives of the people. Coming to the point that you've asked, our work with elderly is very recent. And with first few set of partnerships, we have supported partners for work on center-based interventions and community-based interventions, specifically for elder poor. What we have been hearing and seeing while we are going on the field is that it's an absolute fact that these people are subjected to neglect and abuse, which leads to low self-respect and dignity. And when low self-respect and dignity gets coupled up with illness and age-related ailments, most of the times we see that they are treated as burden and many times abandoned. So there's a definite need to focus our attentions to the basic needs, the roti, kapda, makan. But in addition to that, what is the most important aspect that we have realized is the aspect of dignity. And COVID technically has compounded the difficulties for elderlies and have pushed them into isolation, which is leading to severe mental health issues. Anyway, meaning in terms of mental health issues, we all are experiencing anxiety and depression. We are unable to socialize. But symptoms of mental illness along with aging sometimes is also blur. And this is making an impact on the physical health. So that's what we've seen till now with limited interactions with the partners on the ground. But we are definitely looking forward to work with many, many more partners and work on many more issues, and to definitely decode the healthy aging. In fact, I would say healthy and a happy aging is what is required, so that we are able to add life to the years. So I heard Dr. Gururaj saying that, the age is increased by 10 years, but having years without being productive or without being gainfully engaged is also not very good sign. So that's where we are looking forward to converge, to collaborate, to support many more organizations to make real change in the lives of our elderly. So I'll stop here.
Thank you, madam. I think you brought it out right. COVID-19 has brought out a lot of vulnerabilities and also opened up the divisions amongst in the society. And as you rightly said, you are looking at moving the change makers. I think we look forward to to supporting you and then being part of your activities, so that we also have this advocacy, and we need to push this so that there is a multiplier effect of this. Now, I think Government of India in that sense stands tall in terms of activities done for the elderly till date. That is where I think I'll now request Dr. Sridhara, Channakeshava, Ranga, Reddy. I'm happy to repeat the name again. Dr. Reddy, kindly share your thoughts about the initiatives from Government of India.
Sir, good morning to all. Good afternoon to all. And today I'm very happy to seeing the stalwarts of the senior citizens, especially Dr. Mohan sir and CRC sir. This one I'm so happy. Actually, in our NISD, I'm a deputy director and head of the senior citizens in NISD, and I'm looking the administration and planning also. See, in the 1960-61 till today, we are working for the senior citizens and as well as the beggary issue. We are seeing the beggars, transgender and the drugs related issues we are covering. In our senior citizen division, we are organizing sensitization, awareness programs to the functionaries of the old age homes, daycare center, physiotherapy centers, and the RWS and to the senior citizens. Like we are organizing awareness on dementia care, geriatric care, geriatric counseling, diet and nutrition related programs, government policies, programs, our maintenance act, and our other all schemes related. We are giving the awareness and sensitization program. And as well as we are organizing some training programs. Like 1 year, we are organizing 1 year PG diploma on geriatric care. This is a 1 year PG diploma course. Mainly, this is integrated. One side, we are looking the geriatric and gerontological both issues we are covering. And we are organizing 3 months course like geriatric caregivers. This is a very demandable course also. It is 3 months. 2 months is a theory and practical we are covering, and 1 month on-job training. Nearly more than 450 hours we are covering in this 3 months course, including the orientation visit and practical demonstration. We are organizing national, international conferences, workshops, seminars. We are organizing through the RRTC's regional resource and training centers and through the collaborative agencies like some central universities, state universities, some research institutions, national institutes also. They are organizing this type of programs, conferences, workshops, and this one, sir. And another main this one is in this training course, residential training course also we are organizing, especially geriatric and dementia care and geriatric counseling related. In the 3 days residential courses we are organizing to the RRTCs and our NISD itself also we are organizing these programs. See, now recently, now we are, our secretary also told, now we are plan to introduce our national senior citizens helpline. See, like the child helplines, same module methods we are using for the senior citizens. Already we are giving advertisement in first phase. And yesterday also we gave advertisement for the other 18 states for the RFP we gave, sir, for the tendering.
Dr. Reddy, if I can intervene, can you just share with us briefly about the national helpline which Government of India is planning for the elderly?
Sir, some technical support through the Tata Institute. We are Tata Institute is supporting, sir, and some states they are supporting to this national helpline, and some states they are not supporting. That's why we are given advertisement on the RFP. Through the RFP model, we are selecting the organizations who are forward for the ready to organize this one take forward for the national helpline.
Okay. Okay.
We gave advertisements. Sir.
Okay. Okay. Okay.
In that, some technical support. This one through the Tata Institute. They are giving. They are taking some training in programs.
Okay. Okay.
In earlier also, I discussed with the Professor P.T. Sivakumar sir also, sir. In this for the senior citizens helpline, for the relating the counseling related some other issues, that's we want to put like compulsory training over there that staff like coordinators, all the HR related. This one they want to take geriatric counseling programs, sir. Earlier we discussed with the PT Sivakumar. That is what like we want to put like a mandate.
Okay. 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 I think. Thank you, Dr. Reddy, for that insights into the government programs. I will just hold back Dr. P.T. Sivakumar's thoughts, and I will request Professor Mohan to give his thoughts. Then we'll go for a quick round of discussion in case there is time for us. Sir.
Thank you very much, Girish. I know that, we are overshooting time and we have a constraint of having to stop because earlier in the day, P.T. Sivakumar told me that the platform has to be made available for some other team, for some other webinar by about 4:30. So I'll be very brief. It's been a great pleasure to listen to all the speakers, the panelists now, and just before that, the dignitaries during the inauguration. I just want to make 3 points. I think the secretary, the Union Secretary for Social Justice and Empowerment, said that the area of aged care and looking after the elderly in our country cannot be done only by one agency, cannot be done only by government, cannot be done only by the families, cannot be done only by the non-governmental agencies. He said that it has to be a collective, multi-agency responsibility. And I think that kind of a collective multi-agency responsibility is already beginning. I see here the synergies of two ministries coming together, which have always had problems in the past. I'm talking about the Ministry of Health and Ministry of Social Justice and Empowerment. You know, when you have to treat somebody with a problem, it is the Ministry of Health. But when you have to take care of an elderly person, it is the Ministry of Social Justice. Even at the, the ministry level, to interact is not very easy. I find two ministries coming together, two national institutions coming together, National Institute of Mental Health and Neurosciences, the National Institute of Social Defense. I find also, along with governmental efforts, several very, very important non-governmental organizations coming. I'm now referring to the Rural Electrification Foundation, the National Stock Exchange Foundation, also the Azim Premji Foundation. And it is not just a non-governmental organization or corporates with their corporate social responsibility. It's also a great individual effort. I mean, I'm now referring to Dr. C.R. Channakeshava, who is my good friend, former colleague, whose from personal fronts, he has made a major contribution. So I think the collective multi-agency initiative has already begun. If we can all work together, I think the greater investment is already occurring. I mean, I heard earlier in the inauguration that the Rural Electrification Corporation has given 10 crores. Dr. C.R. Channakeshava has given 1 crore. I mean, we have to work together. This is the first point. Now, secondly, I just would like to, I have been working in a number of places, including Australia till quite recently. When you look at the population, the percentage of population who are above the age of 65, India, it is not very high. People refer to, Dr. Gurish referred to it earlier, they're only about 6.5%. As compared to the other extreme is Japan with 28%. And in between two of these are countries like Australia, USA, etc. But in terms of actual absolute numbers, since we have a population of 1.3 million, even if it is only 6.5% above the age of 65, it's a huge number. So the steadily increasing enormity of the problem has been highlighted. Gurish also mentioned that we are doing very well as far as the average longevity of life is concerned. It will only increase. I mean, the best in the world, again, in Japan and Switzerland, it's 83, 85 in women, and it's only a question of time that we will reach. That means that we will have increasingly higher number of elderly people who have to be taken care of. It's good that we have already come together in this way. This has to grow. And the third point, and I would close with that, is that it is easier said than done. Aged care, even in very highly resourced countries, is a very, very problematic area. For example, the country that I'm most recently familiar with in Australia, it's one of the most highly resourced countries. It's called the lucky country. Enormous natural resources, very small population, 25 million. Aged people, the proportion of people above the age of 65 is about 15%. But very recently, the government had to appoint a royal commission to go into the aged care facility to see the quality and safety. Because there were television reports about elderly people in aged care facilities being abused. I mean, in India, a lot of them are not in aged care facilities, but they are in their families. We talk about children abusing the elderly. Dr. Chandrasekhar referred to the plight of the elderly in our country because of various reasons, social, economic, etc. So even in very advanced countries with much substantially higher amount of funding available, caring for the elderly is a very difficult task. I'm talking about it also from my personal perspective. With me and my wife lives my mother-in-law, wife's mother, who is 93 years old, who has Alzheimer's disease. Fortunately, she doesn't have a lot of behavior problem. But then when she has a sundowning, when she forgets, when she grieves for her parents who died maybe 50 years ago. She doesn't remember that. She asked for her mother or father, and when we say they are no more, she has to grieve again and again. So it is not very easy for the care. And the last point I would like to make is that the efforts of NIMHANS and the National Institute of Social Defense and the National Stock Exchange Bureau with their support, etc., should be for caring for the care. Training programs, support programs for family caregivers, care and support programs for people who work in nursing homes and such aged care facilities. So it has been a great delight to listen to all the participants and all the speakers here. I would now hand the thing back to Girish to request PT Sivakumar, who is the host of all this and who is the head of all this, who has to take this movement forward. Being the head of the geriatric facility in NIMHANS, I hand this over to Girish. Thank you, Girish.
Thank you, sir. I think you brought out one critical point, that not one agency. I think that's what has been a learning through and through. There's a request from the audience. They want all the panelists to switch on their cameras so that they could see it on a grid. I request Mrs. Rema, Mohan, Bharti, Dewan, Reddy, all okay. I think that's more appropriate. I think someone wants to take a screenshot. I will just use my moderator's privilege to ask one question to Ms. Rema Mohan. Now, I think multi-agency effort is one thing. Now, your experience has been to look at different organizations. Just a quick yes or no or a quick comment. Do you think it's a doable, feasible thing?
Yes, absolutely it is. And in our case, we have worked towards convergence and collaboration, which are the mainstays of most of our programs. So even when we go to, and work on the field, we always exhort at every level. So what I mean by every level is you have the field level, you have the organization level, you have the human resources level. So what we say is you have to converge, you have to collaborate, because that is the only way you can pool in resources and create efficiencies within the project. Otherwise, it's impossible. Now, no one person can do it alone, or one organization.
Okay, thank you. I think we take home that positive message that yes, it is doable, and we all have come together to take this first step. With this, I will ask PT to share his thoughts in terms of saying thank you to all of us formally. Yeah, PT.
I think it is really overwhelming kind of support what I have got from our institute, as well as all the panelists. I think in the last few years, I've been trying to reach out to various organizations for getting support. And I don't know, everything good comes in a very, very short period of time. In the last 2 months, I've been overwhelmed by support from REC Foundation, from the CRC Chandrasekhar sir, and various other organizations. I think some are in the pipeline, NISD is collaborating, and we are reaching out. I think what I feel is that we have to find the right person at the right time with the right idea. There are a lot of people who are doing good work, and it's a revelation for me. Many of these organizations I didn't even know. And it's actually a gracious thing that people have introduced each other, and then I've been able to get across, and we've been able to get support. And I think to people looking for support, I would say one should not give up. One should for a right cause, we need to keep pitching, and you will get a right time. And we need to show and implement. And I think that's a bigger responsibility for us. I think getting is one step. I think now we have a bigger responsibility of making it a very, very viable, and we have a long way to go. And including getting this hall, I think my friend was supportive enough to give change the pre-scheduled program. It's actually fitting that I finish in time, and then we hand over that to the otherwise we would not have been able to have this program. The yoga team is already there. So I thank all the panelists. I'm sorry we are not able to have more time and more questions, but I think we had a very good discussion from all the speakers and all the people who mattered most. And I think I have to thank Professor MK, Professor Mohan, our teacher, who even no formality, just a phone call, he called me and then he agreed, and Professor C.S. Chandrasekhar and all my team who have worked behind, they all done a phenomenal job of coordinating this activity. Thank you one and all. And also I thank my teacher, Professor Matthew Verghese, who have been the guiding force for us for the last 20 years, and my team, Preeti Sinha, and the entire geriatric team, so many people who collaborate. It is difficult to name everybody. It's a multidisciplinary team. So I thank one and all for this. I think we look forward to a decade of healthy aging, a decade of aging for the 2030. Definitely NIMHANS, the Geriatric Clinic Services team, with all your support, will make a good progress. Thank you one and all. I thank our director and sir, thank you very much for staying through this. Despite all the challenges, you've been staying through this and you have been supporting and encouraging. Thank you very much, sir.
Yes, sir. Mohan, sir.
Yeah, I just want to take half a minute advice to PT Sivakumar, who is taking the lead. Sivakumar, please be reminded that there are two very important women in this panel. The CEO of the National Stock Exchange. I don't know how big it is. I know about the stock exchange. Every day in the evening in the news, we hear about the stock rates, etc. This is the CEO of the National Stock Exchange Foundation. And you have, I heard, the cluster lead of the urban poor. I know about Azim Premji. I know about his work. And so I think the Azim Premji Foundation is probably, they are already working with the urban poor, but now the geriatric poor. So you have excellent compatriots as your panelists. Please make the best use of them. I'm sure they would be more than willing to support you and guide you in this kind of work. Thank you very much, Girish, for letting me make that half-minute intervention.
Yes, sir.
Dr. Mohan, I know that we are all silent and we are also involved in the National Helpline. But, you know, so the collaborations, partnerships happen very silently. But because there is a common goal to which we all work towards. So definitely we are there with NIMHANS.
Thank you. Thank you very much. As a parting message, Professor Gururaj has set a message in the chat. I'll just read it out because it becomes more relevant for us to take forward. One area of investment that is required is to understand, strengthen, and enlarge the scope of protective factors for healthy aging. India is rich in this sphere and can bring out what contributes for healthy aging. I think that's the vision for all of us. Thank you very much for coming together. As I say, coming together is a beginning and working together is progress. And let's see the success for all these things. Thank you one and all. Once again, be happy and stay safe. Thank you.
Thank you so much.
Yes,